of public education, and I'm speaking today with two of my friends here, Dr. John Groppengieser, with director at Professional Services Group, or PSG, and also my friend and colleague, Dr. Mike Zussman at Sunrise Counseling. And we've just been chatting a little bit about the things that we had to do differently during COVID to meet the need of our various populations. John, would you like to go first and share a little bit what you guys have had to do during COVID?
Yeah, certainly. So obviously, it's been a challenge because things are always moving and changing. And so we, as an agency, we operate in multiple different counties, which has been really a barrier or a challenge for us because we're trying to deal with different locations and different clientele. And we really shut things down, pretty much that second week of March, and went completely virtual. And so we stuck completely virtual with all of our clinical stuff for the most part, med management, therapy, even psych evals to a large degree. We're all completely virtual, probably for a good, 4 or 5 months. And so that was a big shift. Luckily, we had already been doing some telehealth with our medication management, so we had some familiarity. But really, it was just diving in and trying to figure out how to keep serving our clients. Luckily, one thing that we found during that time was that a lot of our clients are the underserved. So we serve folks involved with the child welfare system, severe and persistent mental illness, and a lot of trauma. And a lot of those folks had difficulty with access to services anyways. And flipping to telehealth actually had been a real benefit for many of them, which was great. So we continued that and are continuing that, obviously, ongoing and continuing to do telehealth for the majority of our things. But it was a big challenge to not only flip everyone to that format, continue to provide high quality service, but then also sort of follow the changes with insurance, and are they going to pay for things ongoing? Our clients starting to get fatigued on telehealth. What do we do now? What about psych evals? Do we start going back to in-person a little bit, and in what capacity? So it really has been a heck of a year, well, a year and a half at this point, with a lot of different changes. Mike, what did you guys run into, and what have you done with your practice?
So, the cool thing about this discussion that we have is that, we each have different things going on. We're in different kinds of practices. And for me, it's just me alone. So it's just my practice. So it's kind of nice having that control, especially in a time where things were so out of our control, that for me to just make the determination of how things go was actually empowering for me as a clinician. But it was definitely a challenge. The switch to telehealth for me was smooth and easy, actually, which some people probably want to, shake the screen at me, like, how could it be smooth and easy? But I was using, electronic filing and everything before a system, and they had embedded in their system telehealth anyway. So I could just change each session from in-office to telehealth, and then we got going. So I sent out individual emails to everyone, which that was time consuming, or phone calls, and let everyone know. And then it was that Friday, the 13th, when everything hit. And then that Monday I was up and running and seeing people, over telehealth. And John, you were saying about, the screen fatigue of our clients, but also our own screen fatigue. I was definitely a little tired of that and, ready to move on. And so, we fast forward to today, and I recently, as of about 2 weeks ago, just opened up my practice again. And I've been pretty strict in saying that I really only want people who have been vaccinated to come in. And otherwise I'm still offering telehealth for everyone. Now I see kids, so that's a little tricky because, everyone under 12 can't be vaccinated. So I have made exceptions, and, as long as they agree to cover their nose and their mouth with a mask, having kids come into my office and seeing them. And, a lot of that decision-making comes from a lot of consultation. So talking to my mentor and talking to you guys and talking to people at WPA, what are you guys doing? How are you doing it? And a lot of consultation back and forth for that decision-making. So it's been, I think, of utmost importance is talking to everyone about that. What about you, Ben?
For me, I really enjoyed to some extent telehealth. There were things I liked a lot about it, and I was able to continue, and I'm anticipating even continuing some of that. The other thing that I did during this time period was I really got into some of my clients are not able to be seen through telehealth because of hearing or just other issues. Not everybody has great connectivity, and a lot of the people I serve don't have human contact at all, and their mental health was really taking a dive. So I started taking therapeutic walks with clients with social distance, wear masks. So that was kind of a cool thing, and I got some exercise doing it. I really expect to continue doing some of that ongoing because it just was cool. The other thing is I work in nursing homes, and it was not working very well for me to see people on telehealth there for, again, various reasons, largely hearing, but also it's just such a new platform for people that are young and people that have never really had a computer or needed to do computer stuff. It was really off-putting. So after I got the vaccine and I was able to start seeing my nursing homes clients again, I would see them first wearing masks and with a distance, and then restrictions kind of loosened at some of those places, and now some of them are able to say face to face. But all that opens up a whole different set of considerations. And Mike, you were already sharing a little bit about that, and that is, what are we going to do now to get back into practice where we're seeing people? And I'm really curious, John, about where you guys are at. PSG, you got a bigger outfit with multiple places. I kind of like Mike, I've got a smaller practice, and the people that I share a suite with, we all said we're going to see people if they give us evidence that they vaccinated. So we asked for the card, and people have to wear the mask into our building, and they can take a mask off once we know they've been vaccinated when we're seeing each other one-on-one. But some of the clinicians in my suite still mask even in the room. So that's something that is important. Some of that is up to the discretion of the clinician. But I know at a bigger place, PSG, for instance, you guys have to really be more in sync, and you have to have a broader system, a systemic thing. So I was curious how you guys are planning on meeting the need, and what have you been doing differently now with the possibility of seeing people in person?
Yeah, so throughout the whole process, we've been sort of having this ongoing, I guess you'd call it like a crisis or a crisis plan, right? And we're always updating that in terms of what are we changing in terms of back to office? When are we bringing people back in terms of staff? When are we bringing clients back into the office? We started off with just like as needed. So somebody who had a really significant clinical issue that we felt telehealth wasn't good enough for or wasn't adequate to serve, we'd bring them back. But now we're starting to get closer to opening up. And what we've been doing is obviously screening everyone for COVID. So we have a specific screening form that we use. We are still requiring our staff to wear masks, vaccinated or not, when they're with consumers. We're obviously asking consumers to wear masks whenever possible. Though if they are not okay with it, we're not forcing them to. But again, we are making that sort of the standard of everyone still vaccinated or not should be masked during that appointment. The other thing we're finding as we're getting closer to that and having some dialogue with consumers is that we're finding that some consumers say, you know what, I don't really want to come back to the office. I like continuing to do my telehealth. So we're finding that it's creating sort of an interesting mixture of how clinicians are serving people. So they might have a day where they're doing telehealth strictly from home. There are days when I see a few clients and do a bunch of meetings. I don't leave home. And other days where I go in to do in-person testing. And that's kind of the majority of our clinics are operating in that sort of hybrid fashion at this point. But the other thing that we've seen being in more counties is that certain counties, the community standard is very different than others in terms of all the providers everywhere else are back. And so we've had to kind of weigh some risks and benefits to say, do we think about being more hybrid or more in office in certain locations versus others? Which has kind of made it a much more dynamic process now, because as we were just talking about earlier, as things are changing with updates around the pandemic and the virus in terms of positive cases, you're kind of always having to be on your toes and shifting. So Mike, what about you in terms of more of that coming back to the office and what you've been doing in addition to what you've already talked about?
So, admittedly, I was definitely nervous, even though I have the vaccine. Mine's pretty old now. I got vaccinated back in February, and there's talk about it having lesser effects as you move on. That's hence all the talk about the booster. So I was definitely hesitant to come back in, but really excited to. It's such a difference meeting with my clients face to face rather than over a screen. So, like I said before, in addition to, really having people who've been vaccinated come in, and even of the ones like you guys said, not everyone wants to come back in. So I'm still doing telehealth. And then the ones that do, some of them still wear a mask. And so when they want to wear a mask, I'll wear a mask. Otherwise, we're not wearing a mask if they don't want to, if they've been vaccinated. I did my research on a really good air purifier, and it's probably a little big for the space I'm in, but I'd rather it be bigger than smaller. And I have the ability to open my window without, any kind of risk of confidentiality or anything. So I can have my window open and have the air purifier on and have really good circulation. I've rearranged my office to allow for more space between me and my clients. So it used to be, somewhat close, but I've moved the couch to the other side of the room and my chair to the other side. And so we have a very good distance that way. So, as far as those things are concerned, I think those are pretty much the precautions that I've been taking. And so far, so good, knock on wood, it's been okay. But, there's definitely, with everything on the rise, a lot of hesitation, so I'd be curious, moving forward as things continue in this fashion, what's going to be happening.
Well, this has been a really exciting discussion, guys. And I'm feeling like one of the things we need to do now is we need to involve other people in it, because each of us have a different practice, different population that we're serving. And it's like, I can't really imagine how it's going to be at places like in a hospital setting where none of us are serving, or settings where maybe you're needing to be, where people have needed to be physically in the same place for a longer time. So I think what I'd like us to be able to do is continue this conversation. And if the two of you are game, maybe we'll involve some of our other colleagues, Wisconsin psychologists, look around the state and find out what they're doing, because this really is an ongoing conversation, and we're not gonna like have a one size fits all response. I'm sure of that. In fact, maybe what we're really needing to learn from is the nuances here, and to try to figure out who's doing what and how to apply it to our practices.
All day, I've been working on